Welcome, friends, to this 25-minute segment focused on healthcare. And I'm a retired physician. I was MD and then MPH, a Master of Public Health degree. Um, I was planning to go to Africa, but it didn't work out. The dean liked me, and he encouraged me to take internal medicine and cardiology and come back and teach. He said, we're going to have a different program. We're going to train doctors of health, not medical doctors, to write prescriptions. But when you don't feel good and you wonder what the problem is, what can we do health-wise to enhance it and without prescription drugs? He had been the chairman of the pharmacology department. He knew that drugs were not such a good treat. Even though they seem to relieve symptoms, they always have side effects and adverse reactions potential, so that sooner or later you end up with a bag of pills. It's great for doctors in medical practice. The more you prescribe, the more patients you'll have, but it's not good for health. And so basically I did that, and I think I understand health pretty well. I'm 80 years old-ish, and I will, I wouldn't trade my health for all the pills that Pfizer has. So I want to look at some principles here and think that you'll enjoy what we have to share. I've titled this Three Strikes and You're Out. Basically comparing it to a ball game. This is the game of life. And we can win if we use our assets well. And certainly health is one of the most valuable. How not to lose our asset is important. I wish you could see the screen I'm looking at right now. I'm looking at a PowerPoint I put together, and if you have a church group or something, want me to come, I'd be happy to do that and show you and a DVD video as well. But right now we're just talking, and I wish you could see the picture I'm looking at of Salvatore Frascinella, a New York executive who was facing a crisis in his life because he had a serious medical challenge. He was 65 and couldn't walk 2 blocks without severe crushing chest pain, basically, angina. And his doctors thought that he was too risky for bypass surgery. So they had him taking 12 pills a day, basically, and he was getting worse. He, as I said, couldn't walk 2 blocks without chest pain. One of his cardiologists said that if he got off the medicine, as I was suggesting he could do, that he would die. But in 8 weeks, he was off all of his drugs and resumed former activities, playing tennis, climbing hills, and I think he probably outlived the cardiologist. He lived to be 93. And from 65, that's pretty good when he was worried about checking out at that time when he was attending them. So, how did he do it? Not on the Atkins diet. I wish you could see the thermal scan before, which shows a person on the Atkins diet with a large area of red, but a year later, smaller area of red because the diet is high fat, high protein, and it tends to plug up the arteries. And with the high fat, the blood doesn't circulate as well, so less warmth, less heat, less redness on this scan after a year. But and it's not just cholesterol. The fat makes the blood sticky, like lifesavers, the old-fashioned lifesavers that didn't have a hole in the middle but just thin. That's what the red blood cells look like, kind of. So they're designed to give up the oxygen, but when they're stuck together, they don't absorb as much oxygen. And when they're stuck, they also the capillaries are 4 microns in diameter, while the red blood cells are 7. They have to fold over to scoot through the capillaries, but when they're all stuck together, like coins or lifesavers in a stack, they won't fold very well, and then you need more pressure to push them through. Blood pressure goes up, etc. So not good situation. Pritikin discovered all this, and he getting people off of the high-fat diet. Angina disappears. They got some off the blood pressure medication. 85% got off high blood pressure medications, and a similar number for getting off their diabetic drugs, because fat blocks the insulin receptors in the body as well. And people have insulin, it's just not effective because it's blocked by the fat. If you could see my screen, you would see how blood pressure varies from the heartbeat. When the heart is beating, the pressure is high, and then it's relaxing until the next heartbeat when it goes up again. So beating, relaxing, beating, relaxing, beating, relaxing. And it ranges, whatever your numbers are. I recently had mine checked. It was about 120 over 70, and that's very good. Basically, when I was taking my training, they considered 140 to 160 as borderline, and on the upper numbers, and 90 to 95 as borderline for diastolic. Well, today doctors want to treat you with blood pressure drugs, and it is true that if you have lower pressure, it's better. But I don't think it's better to take drugs to get them down. I think it's better to eat a low-fat diet, minimize your salt, don't use alcohol, don't use caffeine, which makes the heart beat faster, makes the blood pressure go up, etc. Get enough sleep, get exercise. Those things help the blood pressure. If you don't get enough sleep, you have stress hormones that'll drive your pressure up. So there's half a dozen things that I've just named, things that aren't good, like high fat, high salt, alcohol, caffeine, lack of exercise, and stress, and so on. So that's it in a nutshell. And nowadays, I'll just tell you, when I was at Loma Linda teaching, the American Heart Association sent a bulletin out to doctors and said, unless your diastolic, which is the lower number, is 105, you should begin with environmental factors like diet, exercise, sleep, and so on. So but if your lower number is 105, start with a little prescription they want to give you. Maybe that's. But I'm saying do these things first. You'll be better off. And I wish you could see now the screen that shows the red blood cells stuck together. You call it rouleau formation. And if you're on a high-fat diet, you have it. So the Medical World News, September 1 of 1981. That's now 40 years ago. Strict diets can get most diabetics off of insulin, adult onset. And we have a lady living with us right now who was a charge nurse, but she had a stroke, went to a nursing home. She begged us to take her home with us because she says they're killing me with all these drugs. And when she came, she had been on a dozen pills a day for her stroke, her nerves, her sleep, her diabetes. But we got her off all those drugs. She was a zombie when I rolled her in a wheelchair. She couldn't walk or talk hardly, but in a week or so off of the drugs, she gets around, she talks, etc. So much better. It's really what we eat, what we put in our mouth that affects body chemistry most of all, and we don't need the chemicals from big pharma. Actually, if you think about it, the body is designed for self-healing. Cuts, burns, bruises heal. Most conditions are reversible if we know how to cooperate with the body's mechanism. And Dr. Breslow, Dean of UCLA, found that people with half a dozen health habits had an 11-year advantage over people who only had half that many, only 3 health habits. The big 3 that we don't want to have is smoking, drinking, and obesity. That's bad, but the minor 3 might be exercise, sleep, drinking water. Breslow asked, are you happy? In other words, are you under stress? His study was done before it began before the Framingham study on cholesterol was reported. So he didn't really even ask them, but if you know that cholesterol is a problem and minimize it and you're in a good range, you can do better than 11 years advantage. So that's kind of it in a nutshell. Don't smoke, don't drink, don't get fat, eat a good breakfast, and get exercise, etc. My way of remembering this is a little acronym called New Start, and it stands for N for nutrition, E for exercise, W for water. Water is the best beverage that nature has provided. we pervert it a lot when we add flavorings and sugar and those drinks that lower our immunity to COVID and other things. Basically, we can do better if we eat a healthy diet. New Start, the rest of this acronym is sunlight, and that's vitamin D. Vitamin D is also helps your immunity against COVID and other things. It helps your calcium metabolism, strengthens your bones, prevents osteoporosis. Exercise will do that too. Temperance is balance, not drinking. Keep everything in balance, but things that are bad for you, avoid. And air, don't smoke. Pure air. They're filling the sky with chemtrails, not good. And basically, we need a minimum of 5 to 6 hours of sleep. Hopefully more. 7 is better. And so New Start, nutrition, exercise, water, sunlight, temperance, air, rest, and trust in God or nature. If you're all stressed out, we don't get as good a mileage. Father of Medicine said, let your food be your medicine. Nature cures. And I believe that that's a lot of truth to that. Breslow believed that, and I have a U.S. News and World Report cover story on how to reverse heart disease, really featuring the cardiologist in California, blocking on his name right now. But anyway, he did well with Pritikin's program, but used it, and people came to his center. And so another cover story is the National Geographic in November of 2005, featuring Loma Linda, which is where I taught health. It was the only blue zone in the Western Hemisphere, and people in that community live about 7 years longer. NIH gave my school $40 million to learn why, or how it was that they lived about 7 to 11 years longer. And it was really because of the founder of that school, Ellen White, who wrote really excellent material on diet, health, and she was not favorable to prescription drugs. She didn't want drugs taught at her school. Sadly, they hijacked her school and to teach pharmacology and become accredited like a regular medical school. But that's not what she wanted. Anyway, going on, she was 100 years ahead of her time on numerous issues, and she said that drugs do not cure disease. In most cases, they change the form and location. That description I struggled with as a young doctor, a medical student, to see how does a drug change the form and location of a disease. Well, today we call it adverse drug reactions. You take the drug, and you may have a reaction. You suddenly it changed the form and location of your focus of attention. And so that's kind of it in a nutshell. Dr. Clive McKay of Cornell University reviewed Ellen White's writings, and he summarized a 7-page review to say that there was, even though she wrote long ago, there's no better overall guide available today. People, let's see, going on, adverse drug reactions, which I just mentioned, were responsible for 106,000 deaths in hospitals under monitored conditions. These drugs were properly prescribed and administered, it said, in the Journal of American Medical Association. That's JAMA, J-A-M-A, and that was on tax day, April 15, 1998. Lots of people have cited this and think, well, in that article it mentions that drugs are the 4th to 6th leading cause of death, adverse drug reactions. Well, that doesn't sound like too scary, except that the CDC doesn't even mention the 4th to 6th. They have a list of 10, don't even mention drugs. They're really lying to us, okay? And then 2 years later, the Western Journal of Medicine reported 199,000, written by Dr. Weingart, and this was outpatients. The first study in the JAMA, Journal of American Medical Association, was in hospitals. The second study, 2 years later, was outside the hospital. And more people die not in the hospital, basically. But if you put them together, that's 305,000 dying from drugs that are properly prescribed. Not an overdose, that would be a different category of death, and not malpractice either. Those drugs were properly prescribed, and yet they died. Death is only one dimension. For drug-related problems, count for 116 million extra doctor visits. When people not feeling well, the drug isn't doing good, a lot more, 116 million, 76 million additional prescriptions, 17 million emergency visits to the emergency room, 8 million admissions to the hospital, and 3 million long-term admissions. These are people messed up for life. Going to a nursing home, you don't want to do that. 3 million of them. So besides, that's in addition to the 305,000 that died. So the total cost is around 76 billion, and 140 people are adversely affected for each person that dies. So that's a huge toll in America, and you could suspect it from the physician's desk reference. It's about 4 inches thick, about 3,500 pages of fine print telling what the drugs can do to you, about adverse side effects, contraindications, drug interactions, carcinogenesis, pregnancy warnings, and your doctor can't possibly remember them all. So basically, this is why we call it the practice of medicine. He writes a new prescription, says, see me in a couple weeks or in a month. He wants to be sure you have not getting something bad that the drug causes. Well, here's a classic statement that I want to share with you from the dean of the School of Public Health where I worked under. Looked up to him because he had 3 doctor's degrees. He was MD first. He did a good job of teaching anatomy in at the medical school, so they asked when they needed a head of the pharmacology department. He got his PhD in pharmacology from Stanford University, and he shares this text statement with me from Drill's Textbook of Medicine, of Pharmacology. It's Chapter 5, Mechanisms of Drug Action, and here's the statement. Drug action always represents artificial interference with the natural functioning of the organism. Now think of that. The body is designed for healing. Cuts, burns, bruises, broken bones heal if you just give them time and protect them, mobilize them, sew it up, or put a cast around the broken bone. But if the drug action represents artificial interference, not good. And it says, the statement says, pharmacology and toxicology are one. Actually, pharmacology grew out of toxicology. Toxicology was how much chemical can kill the rats or make them sick or whatever. And pharmacology is a science that grew out of that. Evolution, I don't believe in that evolution, not good. And the art of medicine is to use these poisons beneficially. Can you believe that statement? Well, if the blood pressure's sky high, yeah, you maybe need a drug, take it and get the blood pressure down. But generally speaking, drugs should not be a chronic situation. If you had a serious accident or a serious acute thing, take a drug, get it under control. But we should learn to live well, eat well, and so on, and not have to use drugs chronically, because they are poisons. It says every drug is by definition a poison. So let's be advised. And I just explained how we use poisons beneficially with high blood pressure. There are various things like caffeine that will run your blood pressure up, or alcohol as well. Problems come often from in caffeine with a drug that's classified as GRAS, generally recognized as safe, GRAS. And sadly, the FDA calls caffeine a safe drug. Well, I wish you saw it from my perspective as a physician in private practice. I'm going to give you about a dozen different things that it can do to you, caffeine, because most Americans use it. They think the caffeine even has advantages. Well, not really. Its advantage is because we're addicted, and if we don't get it, we feel really bad. But if you try to stop the caffeine, you may get headaches. That's a common withdrawal symptom. That's why Anacin and Excedrin put the caffeine in their drug to relieve the headache of withdrawal. If maybe you didn't have enough caffeine today, take a dose, headache is gone. Anacin or Excedrin. Not good. Get rid of it all, and get off the caffeine, and you won't have headaches anymore. Nervousness, insomnia, indigestion. The drug makers love caffeine because it makes stomach acid turned on, and you need something else for your stomach, or antacids, Pepsid, Rolaids, um, acid blockers, etc. Or you get ulcers, GERD, gastroesophageal reflux disease, because caffeine weakens the sphincter, the little muscle at the bottom of the esophagus and at the top of the stomach, so that acid reflux goes up into your esophagus, and you feel bad symptoms up into water brash, feels like acid up in your mouth, throat. Increased blood pressure because the heart will beat faster. My daughter got breast lumps when she was working the emergency room or the hospital late at night. Couldn't stay awake. She drank Cokes and got lumps, but her doctor said, well, quit the caffeine, and her lumps went away, basically. Lumps, cleft palate, hair lip, these are something that occurs from chromosome damage. The caffeine can do that. If a woman is drinking lots of coffee during pregnancy, the child may be born with a disfigured upper lip, or palate. Osteoporosis. Cancer of the pancreas is reported by the New England Journal of Medicine. In several hundred cases of cancer of the pancreas, they found that coffee drinking was a major risk. Not so for alcohol or tobacco, but caffeine, yes. Elevated blood sugar and triglycerides. And bad habit glue is what Pavlov, the Russian scientist, called it bad habit glue, because it glues our bad habits. People live poorly, get to sleep late at night, wouldn't be able to wake up in the morning without their bad habit glue. They can get up with coffee and get going okay. So all of that to say that it's a potential problem. I want to see what kind of time we have here. Couple 3 minutes left that I need, so I want to oops, I lost it. Here we are. Medical article in the Archives of Internal Medicine, September of 2007, said that deaths in their study increased 2.7-fold from 1998 to 2005. So in a 7-year period, the 305,000 that we talked about went up 2.7-fold, and we now have 824,000 deaths a year from drugs. That was in 2007, and that made medical care, adverse drugs, number one cause of death, worse than heart. Most people think heart disease, and the CDC reports heart disease as number one. Not good. They're liars. They're in business with the drug companies, and they don't want you to know that the drugs are dangerous. They're making money that way. So bad situation, basically. If we think about it, it comes down to the fact that 9/11 was a disaster with 3,000 deaths, but with drugs we have more than that. We have a 9/11 happening twice a day, really, in reality, if you were to consider it. Congress grounded the airplanes in 2001 when the 9/11 occurred, and they were trying to prevent deaths, they said, but if you go to Congress now, they won't stop it because of the drugs. I took medical literature through the U.S. Congress and tried to show the senators that its number one cause of death is prescription drugs, until one senator said, you're wasting your time. They own us. Speaking of donations that the drug companies make to their reelection. And so my point is that they're sold out. Government is bad. They don't care about you. They just want to get their perks from the drug companies, and they probably have investments there too. Not good, basically. So I would just say I have a book that helps tune us in a little bit, From Lockdown to Knockdown, The Fall of America. And if you go to Amazon, type in my name, Richard Ruhling, Ruhling, you can see this book. Click on the the cover, it says look inside, and you can read the contents and the introduction without even buying it. And you can click on the links and learn about COVID and some of the bad stuff that can happen if you get your shot. So I'm helping you right now, and this is enough for this 25-minute segment. God bless you. We'll see you again tomorrow or sometime soon. Thank you for watching and sharing it.